So that classic sinus patient that we've treated for decades, right, as a specialty, chronic sinusitis. They've got symptoms that never go away, months and months and months of pressure and drainage and congestion, and they've been on the antibiotics, they've been on the sprays, they've done all those things, and they're just not getting better.
Absolutely. There's also this other group of patients, we call them recurring sinus patients. So they get treated and they get better and they feel good for a while. But then it comes back. It can come back 4, 6 times a year. That's a ton of visits to the urgent care, to their primary care physician, a ton of medical therapy. And if it stopped, that would be okay. But this is a thing that happens over and over and over again. Both sets of those patients are wonderful candidates for balloon sinus dilation.
Yeah, you really don't want your sinuses to run your life.
Absolutely.
You don't want to be thinking about them all the time.
Right.
And if you have to miss work and take a bunch of medicines and do a bunch of things like that to try to keep feeling normal, there's an easier, better way to fix that long term, typically.
Absolutely.
So those people are great for that, right? You don't want to have those symptoms all the time. Another thing, the main thing, right, that bugs people are this pressure. If you get that pressure in your forehead that kind of goes down to your cheek sinuses, that's the number one symptom in my practice of patients that just drives them crazy.
Absolutely. I couldn't agree more. Those patients come in and they say, hey doc, I need to take a decongestant every day of my life in order to make sinus pressure go away. Let me tell you, that's not healthy. That's not a good thing for you. You want to be able to have your sinuses work without taking a decongestant in order to alleviate sinus pressure. So instead, you can have a procedure done so that you don't have to be on those medicines over and over and over again. Other symptoms like postnasal drip and cough and nasal congestion are symptoms that go along with chronic sinusitis, but sinus pressure is the number one thing that people come to see me for.
Right. Yeah. You don't want to be on Sudafed all the time, just
Nope.
make your face not hurt.
Nope, that's not okay.
Another group that's great, revision patients.
Absolutely, absolutely.
We've had a bunch of people that have had surgery before, and maybe they had a bad experience, and they don't want to do that again. So it's nice to be able to offer them something that's kind of more minimally invasive, that's still going to get them where they need to go, and reset their baseline back to something where they're feeling good again.
Absolutely. You know, why do people need revision surgery? It's often that they have scar tissue. And so something like a balloon sinus dilation, which uses a minimally invasive technique. You know, we say that all the time, and you wonder, do people understand what that means? That means that we are not cutting, we're not removing tissue. And if you don't do those things, there's less of a chance of scar tissue, less chance of scar tissue, less chance of that 3rd or 4th surgery. We see patients that's happened to.
Well, especially those people that have had surgery before, they'll go through this and they'll say, okay, I feel better, I'm breathing better, my pressure's better.
I was back to work fast.
It was a lot better experience than the first time.
Absolutely.
So those are some of our happiest patients.
Yeah, it's great to see them back again on their first visit because they're so happy, and you hear thank you. That's awesome.
Makes going to work fun.
It does.
Yeah.